Hi, everybody. This is Dr. Shea from Align Life Chiropractic and Wellness. And today I'm going to be going through how to bulletproof your posture. So this talk comes off of sort of piggybacking our overall theme for 2022, which is to live different. And the reason why I feel like very passionate about this topic is because I've noticed overwhelmingly that if we just go along with the crowd in respect to how we eat, how we move, how we think, especially in respect to our structure, our posture, then ultimately we go down a path that's going to lead us towards sickness, disease, and injury susceptibility. So in order to live in the modern world, but to express overall health in a very different way, an abundant way, we really have to live differently. So in those categories of eat well, move well, think well, and structurally well, today, obviously, we're going to flesh out in detail the concept of posture and what this means to someone, not just from the perspective of things like pain and so forth, but we're going to really talk about it in the idea of looking at optimal health and overall function and longevity. So if this rings a bell for you and you want some more information, then please continue listening to this. I'm excited for you to go through our process. So the things that we're going to cover today, first, I'm going to talk with you a little bit about just some general understanding, some anatomical concepts in respect to posture. Then I'm going to show you 3 different studies that are really powerful. I'm excited to go through those with you. And then lastly, we're going to talk about what you can do to implement things for your own life from a habit perspective that will help you to get to your long-term vision. And remember, guys, living an aligned life is all about identifying the long-term vision that you see for yourself in the future, 10, 20, 30, 40, 50 years from now, depending upon your age. And then it's all about reverse engineering it, which means taking a look at your daily habits and identifying how you live on a daily basis and what that will mean for yourself in the long term. So can you create daily positive habits that will help you to align with your long-term vision? That's the key. So when we jump into this, the first thing I want to talk about is a very clear definition of what is posture. So posture is the position of the body, whether that's characteristic or assumed for a special purpose. So characteristic is just sort of how you carry your body, whether you're in a relaxed position, or maybe you're in a very upright position, maybe you have a military background or something like that. A special purpose posture is the one that we use to be able to accomplish a task. So this would be maybe like a seated position or a standing position or a lifting position or a sleeping position or any other position that you would utilize. So if this is our reference point, then let's talk a little bit about what normal is. So when we look at the human body, we like to look at it from the front to back plane, and we also like to look at it from the side view. This gives us an understanding of where things are in space. And you'll see in a minute why this ends up being really important. The concept of posture in relationship to the human body is based upon something called the Delmus index. The Delmus index is a mathematical equation of a height over length ratio that helps us to be able to understand what position the body would be in if it was in the strongest possible position. And they've done some really neat studies where they've put load on the structure from top to bottom, and they've seen what is the structure that holds up the best over time. And what they found is the cervical curve, meaning the curve in the neck, is a partial circle. The curve in the middle back and the lower back are partial ellipses. Remember, an ellipse is like an elongated circle. So in this position, we end up with approximately a 40-degree curve in the neck, a backward 40-degree curve in the middle back, and then a forward 40-degree curve in the lower back. So that being said, especially when we're trying to create a personalized program for each individual, we recognize that everybody's anatomy isn't designed for 40-degree curves. So keep that in mind when you're watching this, because you may be thinking to yourself, man, there's no way I can get a 40-degree curve in my neck. Maybe that's going to be too much for my body. And you're probably right. So we personalize this based upon some fixed points in the pelvis and the sternum to help us make it so that these are values that are going to fit for your body. And in a minute, you'll see why that's really important. That being said, when we look at the body from front to back, we just want to be able to draw a straight up and down line through the center of the skull, all the way down through the sternum, the middle of the pelvis, and then right in between the feet at the bottom. This would be the ideal front to back posture, very strong in that position. When I present this information to children, I like using the idea of a straw that you would suck through in order to be able to get liquid out of. And I always tell them, straight is strong. If you have a straight up and down straw and you push on it, ultimately the structure itself is going to be very rigid. However, if you were to put a kink in the straw and then you were to press down upon it again, the only thing that you would notice is a collapsed position. So we want to avoid those kinks to be able to avoid collapse. All right, let's talk a little bit about the posture when we look at the body from the side view. So when we look at the body from the side view, we want to bring one line through the whole of the ear, midline of the shoulder, through the hip, the knee, and then into the ankle bone. And you can actually see a picture of that on our PowerPoint here. So I want you to think about this concept, and I'm going to come back to this here later on. There's a concept called sagittal balance. Sagittal balance means when we look at your body from the side view, are we tilted too forward or too backward? Ideally, when we look at the body from the side, when we can go whole of the ear, midline of the shoulder, hip, knee, and ankle bone and have everything line up, then again, just like the Dalmas index, we're going to see that we've got a very strong structure when we look at the body from the side view. So if this is normal, let's talk a little bit about what abnormal is. We call these postural distortions. So when we're talking about posture, it becomes very important to be able to communicate effectively what we mean in respect to where things exist in space. So to make this easier for the practitioner, myself, as well as for my patients, we break this up into the head, the torso, which is the middle of the body, and then the pelvis. So this makes it a little bit easier because keep in mind, every person reserves the right to present their posture in as many different distortions as they would like, which can sometimes become quite confusing. So in, let's say, using the head position, the skull position, things can move forward or backward in the front to back plane, or when looking at the body from the side view, they can move forward or backward in the lateral plane. We can also tilt left and right. We can rotate left and right, or we can actually translate up or down. And the up or down is a little bit hard to understand until you actually start thinking about the idea of, the average individual, as they age, they typically become what? Taller or shorter? I hope you said shorter. That's right. We typically see that people progress downward. Now, maybe that's because we're losing disc height, or maybe we have some compression fractures and so forth. But really, if we're really doing a great job of taking care of our structure, and we've been lucky enough to avoid accident or injury, and we've been good with our nutrition so we don't have a lot of osteoporosis and weight-bearing exercise to build up those strong bones, then what we notice is that the structure actually is designed to last a really long time and should be relatively upright and able to withstand approximately about 100 years of usage, if all things go according to plan, and if you take care of your spine. And that's what we're here to talk about today. So keep in mind, again, we can see these changes in the torso and in the head position. It could also be an alignment change in the pelvis position, which is actually one of the most common things that we notice. So we're going to continue now with an understanding of what's normal now and what's abnormal, but I want to talk about what actually causes these postures to actually become distorted. So why do all of a sudden we get these changes to take place? Well, we either have immediate traumas that are happening fast. So slips and falls, sports injuries, car accidents, workplace injuries. If we get into a fight and we don't end up on the winning side of that, or we have a big brother or sister and we get into a little bit of rough and tumble, or anything else that you kind of get an understanding that happens very quickly. Okay. The other way that we can have posture that becomes distorted is if we end up with repetitive stressors that take place consistently over a period of time. So this is all your body position habits. So sitting, standing, sleeping, lifting, cell phones, laptops, working from home now at the kitchen table or in bed or at the coffee table. These are all the things that we hear about most commonly. So the immediate traumas that cause postural distortion, unfortunately, we don't have too much control over this, right? If you get in an accident, it is what it is. Unfortunately, we don't operate in a bubble. However, the things that take place over a period of time, the postural distortions, be based upon body position habits, these are the ones that I like to put a lot of emphasis towards, because these are the ones that we can control. And ultimately, aligned life is all about taking full responsibility of your health, and your posture and how you present your body is a really important thing associated with that. So we're going to focus on our attention in these. So what's so important about your posture? Well, ultimately, posture is the window to the spine, which essentially means how you carry your body gives us an understanding of how healthy your spine will be. And if your spine is healthy, then you have the capacity to change another system within the body, which is maybe even more important. So before we get to that, let's talk a little bit about spine. So what does the spine provide for us? The spine is going to give us three things. It's going to provide for us flexibility. And in the medical world, they call this range of motion. That means how much flexibility, how much turning up and down, lateral bending can we create in the structure. Second, it'll provide us structural support. And we call this your posture. I always think of your bones in your spine and your pelvis as sort of like the steel girders of like a big, tall skyscraper, right? These are the big structural supports. And then lastly, the spine provides for protection. And this protection piece may be the most important aspect of what the spine provides. And I was referring to this a second ago. It's that other system in your body that maybe is the most important system that our posture helps us preserve. And guys, that's your nervous system. So your nervous system is, again, made up of three parts. It's the brain, it's the spinal cord that connects the brain going right through the middle of the spinal bones. And then it branches off into the nerves, the peripheral nerves that go out into every single cell, tissue, and organ in your body. Okay, so this is a super important system because ultimately this is the communication system of your entire body. So just like in any relationship, if your communication breaks down, then ultimately the entire system breaks down. The same thing happens in your body. So keep in mind, the nervous system is intimately tied into the spine and into the spinal cord. So what we notice is that any changes in alignment based upon postural distortions can cause stress or irritation onto the spinal cord and nerves and make it difficult for us to communicate effectively from brain into body or from the body back into the brain. We used to believe that the way our nervous system worked was that the brain would take information and push it down the spinal cord out into the body. And that was a one-way communication. But now what we realize is it's actually about 60% the opposite direction. We use receptors in our body. They can be receptors for movement. They can be receptors for pressure or temperature and so forth. We gather information about our body, and then we send that information up the spinal cord into the brain, where the brain can then interpret what to do about the environment, and then it pushes about 40% of that information back down. So it's this constant feedback loop. And in chiropractic, we call that the safety pin cycle. If you can visualize a safety pin in your head, we've got the brain at the top. There's a line that comes down, going down the spinal cord. Then there's the body, and then the body sending signals back up to the brain. So when the safety pin is connected, we see that cycle loop all day long, and it's effective. Our body can adapt to the environment. You can be healthy. You can function at 100%. In contrast, if we have misalignment in the spine or big postural distortions, then what we notice is that it's almost like the safety pin becomes unhinged. So now the brain is trying to communicate, or the body is trying to communicate, but we're not getting that signal through. You can think of that as interference. Or another way of thinking of that is the energy of the body is reduced. Those signals are turned down. Think about, almost like the lights in your home are dimmed, right? We turn that dimmer switch down. Everything now is reduced. You're not operating at 100% full potential. And in that environment, we open up ourselves to all sorts of different challenges, whether that's injury susceptibility, sickness and disease, a lowered immune system function, poor adaptation for things like being an athlete and being physical with our bodies, and so forth. So how the spine presents in respect to your posture, how you carry your body, gives us a tremendous understanding as to how your body's going to function and react based upon the function of your nervous system. So if that's not a big topic, I want to move away from that for just 1 second, because I want you to understand this at a deeper level. So guys, your spine and your posture must match. What I mean by that is how you are genetically designed to stand and to have anatomy, meaning your bones, your structure. It has to match the way that you carry yourself. So if you're designed to carry yourself in a good upright posture, but all day long you sit in front of a computer in a slouched position, this is a spine and posture mismatch. A mismatch creates poor postural habits. It gives us stiffness, tightness, or we can call it range of motion loss. And it puts stress and pressure onto the nervous system, shuts down that energy getting out of the body, and it lowers our optimal function. So we always want to make sure that how you're positioned in respect to your overall habits aligns with the way that your body was designed to have you positioned. So this is really important for most things in life. So we're going to go through and talk about how we do this at the end of the talk today. The next thing I want to talk about is 3 studies. These are super powerful. I think that they really help to illustrate the things that I'm trying to describe to you. And I want you to know that the things that we're talking about today aren't just my belief system based upon my clinical experience of 15 years at the time of this recording. They're really based upon what is the best understanding that we have in healthcare from multiple different fields and from multiple different timelines. So you're getting a real understanding of what is the best research out there supportive of in respect to how we build our health. So this first article is actually a 2021 study, July, and it's published from a couple of researchers. There's a physical therapist on board with this study, as well as a chiropractor. And what they talked about and what they were looking at is how they could influence how fast the messages were being sent from the brain into the body based upon how much curve a person presented with in their neck. So we know, based upon the research, that if you have lost the curve in your neck, they call that cervical lordosis, that's the neck curve. If you lose your cervical lordosis and you flatten out your curve, oftentimes this is associated with forward head posture presentation, then how fast the messages get from the brain through the spinal cord and across the nerves is reduced. The cool part is, from a treatment perspective, and what we really focus on at Aligned Life, and what the quote says here on our PowerPoint is restoration of the cervical curve, as well as the sagittal alignment, which we're going to talk about more, but that upright postural position has a direct influence on central conduction time. That's the speed of your nervous system. So the better your curve systems, the better your posture, the better your nervous system works. And this is a 2021 study, so very, very up to date, at least at the time of this recording, and pretty powerful stuff. So I love seeing this. So how does this work? This is our second study. This is actually taken from some medical doctors out in Sweden back in 1966. So this is information that's been around for a long time. What they found was that mechanical stress, meaning how the spine was positioned, determined how much stress was actually placed upon the spinal cord. So keep in mind, in the spine, there's a hole that runs right down the middle of the spine itself. The spinal cord passes through that hole all the way down. The spinal cord takes the path of least resistance, you could think of that, or the shortest path between 2 points. So if you have a curve in the neck, what they found is that the spinal cord went relatively slack all the way down to the bottom. And the spinal cord is connected at the top by the brain and at the bottom by something called the cauda equina. So it's all connected. So when the spine itself is in a relaxed position with good curves, the spinal cord can then also be relaxed, which allows to send a quality signal without interference between the brain and the body. In contrast, in these cadavers, what they would do is they would eliminate the curve systems. They would put people into forward head posture. They would flatten out their curves. And what this would do is it would bring the spinal cord into a taut tension position. And it would actually, even in many instances, have the spinal cord run up against the back of the spinal bones, which causes pressure and stress over time. So we could see how very easily that could compromise our capacity to be able to get a fresh, good signal from the brain into the body so that you can heal and you can express health. So this is kind of an interesting study. This is done by Bragg in 1966. The third study that I wanted to go through is this one looking at sagittal balance. So again, we've talked about the idea, and you can see on our PowerPoint here, we've got this green, perfect posture through the ear, shoulder, hip, knee, and ankle bone. This is an article that is from an osteoporosis journal. This is back in 2011, December. And what they talk about here is having poor sagittal alignment. So if we look at the body from the side view and we start noticing all of these forward changes or backward changes, it should be recognized as a predictor of poor quality of life in men and women, even in those without compression fractures or excessive thoracic kyphosis. That means even if you don't have a bunch of curve back here, if you're standing back like this or you're standing back like this, essentially your quality of life is going to go down significantly as you age over time. As a part of this study, they also looked at your likelihood of being able to do activities of daily living without assistance as you age. And what they found is that if your sagittal balance was good, then your ability to do those things without assistance was also good. In contrast, if your sagittal balance was poor, then you'd have to depend upon someone else in order to be able to do simple things in the future. We also know that your likelihood of chronic pain goes up when your sagittal balance is poor. So guys, I've done thousands of consultations with people, and I talk to people about what their goals are for the future, because that helps me to understand how we would need to carve out their daily habits to help them get there. I've never once heard anyone say, as a part of their goals, that they want to be dependent upon other people to do their activities of daily living, and they want to have chronic pain as they get older. So sagittal balance is a really crucial way in helping people to understand how that structure causes optimal health or gives us a reason to not be in optimal health as we age. So super, super important. So the number one question after going through these studies with people that I often get asked is, what can I do to help myself? You know, people want independence. They don't want to be dependent upon other people for their health. So here's the things that I often talk to people about. Number one, you can improve your postural habits. You can use supportive devices, and we're going to go through both of those in just a second here. You can also implement postural exercises, work on things like massage therapy, physical therapy. You can do full spine traction, and you can go to the chiropractor and get adjustments to be able to work on your alignment, maintain your range of motion, take the stress off the nervous system. So the postural exercises, massage therapy, the traction and adjustments, these are all things that you need help from another person to develop and work on for you. But the habits and the devices are things that you can do for yourself. So let's talk a little bit about the habits. So the things that I often hear most is, what position should I be sitting in and what position should I be sleeping in? These are the ones that give people the biggest challenge for sure. So from a seated posture perspective, the number one recommendation that I make to people is start with your feet flat on the floor, which I know sounds simple, but keep them at about shoulder width. Most of the time when we sit, we have a tendency to bring one leg up underneath ourselves. We sit on a foot or we cross our legs. And as soon as we do that, our posture rolls into this forward flex position. We lose our lumbar curve and everything kind of goes poorly above that. I also encourage having your seat height so that your knees make a 90-degree angle. Same thing, having a 90-degree angle at the elbow. And we want to keep our wrist in a neutral position so that we can try to avoid carpal tunnel. So we just want to have a nice flat wrist all the way across, just like this. Keep your keyboard and your mouse close to your body so you're not having to reach out in front of yourself in order to be able to get to those things. Try to keep your monitors up, guys. We want to get everything up in front of our face. That way we're just looking straight ahead. We don't need to look down in order to be able to get to a visual sight line with our screen. Keep in mind, your environment oftentimes dictates your capacity to be able to maintain a good posture. So it's your responsibility to set up a good environment. If being in a seated position all day long is not good for you, then you've got to change it. So I recommend using things like a standing desk or maybe an exercise ball or something that you can continually be moving in to change your position to help you be able to get out of the seated posture in front of a chair, okay, or on a chair. So that's sitting, guys. Let's talk a little bit about sleeping. So the sleeping posture, number one, we want to avoid being on your stomach. Because why? if I sleep on my stomach, then inherently, if this is the mattress, I've got to sleep with my head turned to the side all night long, which eliminates my capacity to be in a neutral position. And neutral positions are easy on your spine, they're easy on your joints, your discs, and your nerves. So the two other positions that we have as options are sleeping on your back. This is probably the most neutral, as long as you've got a nice supportive pillow underneath the neck. I encourage a pillow that has a little bit of a curve in it. That curve is going to support your neck and then cradle the head. Sleep with the arms below the level of the heart. Try not to sleep with your arms up above, because oftentimes this will wake you up. You'll start getting numbness and tingling into the hands and arms. If you're going to sleep on your side, now you're going to have to account for the fact that if the mattress is over here, guys, my shoulder has now just created a gap between my head and the mattress. So I need a supportive enough pillow to make up this gap. Otherwise, I'm going to sleep like this if I have one pillow that's too thin, or maybe I use two pillows and now it's going to be too thick and I'm going to sleep the other direction. So find a nice supportive pillow, have a spouse or a friend look at you in the side posture sleeping position. Make sure that you're in a neutral spot the whole night. Also, keeping your arms out in front of you. Oftentimes when people sleep on their side, they want to sleep with their arm up overhead. That's not good. Again, you're going to get into that sort of sleepy arm or numbness tingling into the arms. I also recommend a pillow in between the knees. Otherwise, your pelvis has a tendency to collapse, and then oftentimes we lead to pelvic or lower back pain. In these positions, you're just looking for something as neutral as possible. So I recognize that from a sleeping posture perspective, this is probably the most difficult one to fix, because who the heck is aware of what's going on when they are sleeping? My big ask for you is if you wake up and you're in a poor position, just flip back over. Don't give yourself any shame or guilt. Just flip back over, get into a better position, try to get back in and get some rest. The second thing I want to talk about of an action step that you can implement for yourself are postural supportive devices. So in our practice, we are big believers of using these home traction orthotics. Home traction orthotics can be for your neck, your middle back, or your lower back. They are only prescribed to you by a chiropractor who knows what they're doing with these, because they're based upon your x-rays and your postural photos. Otherwise, you can actually use these to your detriment. So despite the fact that you can jump online and probably find something that's similar to this, maybe on Amazon, you're really taking a risk by not knowing how to place this and how to use them. I've seen people that have come in and they've actually caused damage to their spine and actually made their posture worse, despite the fact that they were trying to do something to help themselves. With some good research, we see that these can actually increase the cervical curve, the mid-back curve, or the lower back curve, and change those curves somewhere between 5 to 15 degrees about every 90 days of full-time usage. So there's some really good stuff associated with this. I also encourage the use of lower back supports. Like, let's say if you are driving for Uber or Lyft, maybe you're a truck driver, maybe you have a seated job, or you have a long commute. The lower back curve can help to keep your entire body upright and more stable. So using those low back supports, as well as an upper back support that's going to help to stretch out and elongate the tissue in the chest and pull back and give you some postural awareness. Retracting the shoulder blades, pulling those back and down, getting your head position upright. I have surgeons, I have hairdressers, other chiropractors, physical therapists who are leaning over clients and working with people all day long. They use these upper back supports all day long to be able to help maintain their structure and give them a little additional support when they're trying to maintain their posture all the way throughout their workday. So I know that I've talked about a lot of things, but I wanted to give you guys an understanding of how we work at Aligned Life and get a sense of some of the changes that we're making at the office real time. So here's a case study. This is a person back in 2022, actually early 2022. This individual had all sorts of stuff going on in regards to their posture. They had changes happening in the front to back plane. They had changes happening in the lateral plane. So we really kind of threw the kitchen sink at this individual, and I was really pleased with the long-term outcome. The individual started out with a postural asymmetry in the front to back plane with some distortion off axis. The green lines on these pictures represent the ideal positions of the body. The red lines represent the body's current position at the time of the picture. So the picture on my left, I'm hoping that's the same as yours. That's actually on February 2nd. they've got a pretty good asymmetry off to the left-hand side. About 5 months later, the person went through, we redid an x-ray, and they were just about on plumb, considerably better postural position in this new plane. So what did we incorporate in order to be able to make these changes? So we did chiropractic adjustments multiple times a week throughout the time frame that we were working on. We also provided three-dimensional full spine traction in office. We used those home support devices, the Denerol product that she used as a way to be able to help herself on the days that we couldn't get a chance to work with her. And we also gave her postural exercises based upon her postural photos as well as her x-rays. And she was working on those consistently. We would reevaluate about once a month, taking new postural photos, range of motion checks, and symptom surveys, making sure that we were making progress. And then at the end of the time frame, we reshot x-rays, and then you can see the results that we got. From the lateral plane, the interesting part with this person is, again, on that February 2nd date, you'll notice that this person had a very straight spine, especially through her middle back. That thoracic curve was almost gone. And if the thoracic curve is poor, then there's really no good way of being able to add in a neck curve, because structurally we have to build things from the bottom up, just like you would build a building. Again, we made a really nice structural change through that middle back, and it actually helped to facilitate that neck curve coming back. Overall, this person did fantastic using the protocol that we had given her. You can also notice in her postural photos that this person started out, again, green line representing the ideal positions of the body, red lines representing the body's current position at the time of the picture. The picture on the left-hand side here for us, everything was sitting forward, pelvis, shoulder, and head. But then as she progressed through her care, with a little bit of up and down here, at the end of her care, she was in a considerably better postural position. The cool part about these postural photos is that these are not positions where people are faking it, meaning that they're just sort of like standing upright and sort of falsely creating their new position. These are just having people stand in a relaxed posture and shooting the pictures. So it's really, really great. I try to stress to people that how their posture presents has a lot to do with how their body's going to function, not just from a pain perspective, but from an overall perspective. This was an individual who, through this time frame, 100% eliminated chronic headaches that were going on for her. 85% improvement through the middle back pain, lower back pain also was resolved. So she also had a whole bunch of other symptoms that were involved in regards to her ability to this person is a hula dancer, so they were able to get back into their profession and feel like they could perform at 100%. They were also a mother of 2 children, young children, and it just made a huge difference for her in her overall quality of life. So guys, my hope would be that this gives you some better understanding of how to better prepare your body to handle a work day or a school day or a day with your grandchildren, whatever season of life you're in. And I also think it hopefully will give you some idea of some action steps you can implement. Again, build out your daily routines. Think about the long-term vision of what you want to see happen for your posture and your spine. Again, way down the line, that's going to give you the ideal version of what you need to do on a daily basis to have it come to pass. If you have questions, please reach out to us at Aligned Life. Our website is alignedlifewellness.com. You can reach out directly to myself and my team. alignedlifewell@gmail.com is our email address. If you enjoyed today's content, please subscribe to our channel and like this video. And please be on the lookout for future videos that are going to be all associated with having your body from a holistic perspective get healthier and healthier through natural forms. Thanks so much for listening, and have a great week. Take care.